All right, so good evening, everyone. Tonight, Cristal Boatright and Jasmine Vasquez are joining me. We're going to talk about these lab-based functional medicine protocols. It's not really a protocol. Just going to define a couple concepts tonight on why organic acids are measured. So that's really the basis of this. Cristal is a physician assistant, which I now just learned that they're now called physician associates, and Jasmine's a nurse practitioner. So they're now under the auspices of APPs, Advanced Practice Practitioners. It's all just getting crazier as we go forward. But they're helping me out with the wellness slash aesthetics slash functional medicine part of the practice that we will be doing a dedicated session at IVC this year in April. So please join us for that. So let's just talk of a few concepts here. I'm going to share this screen. I already have. And we're going to go through this. So I've been meeting regularly, and one of the things that we talk about often is patients present with vague symptoms, fatigue, can't lose weight, bloating. It can be anything. And we are categorizing them in the workup of weight loss patients, GI, brain, catabolic, toxic. They're just little buckets that help us focus on what treatment protocol we're going to use. So that's just kind of a background. But what I wanted to get into is this is Dr. Richard Lord, and he's a PhD. He's the one that developed organic acids. And he has this book, Laboratory Guides to Health. And we're just going to take a few pieces from this book. Not so much here. I just wanted to show you where this information comes from. He's the one that designed the original lab, and I think he sold it to Genova. Genova's the big functional medicine. There's many of them, but just the biggest one where we do these functional medicine tests. The adrenal stress response is one of the main ones, the GI effects, and the organic acids, which are under metabolomics, Nutraval, and there's different ones. So a lot of background. Let's just get to what I wanted to try and cover tonight, which is this. So I'm just going to read this slowly. And we've talked about this before. Unlike amino acids and fatty acids, the category of compounds called organic acids contain no essential nutrients. This is the key thing. Instead of directly measuring nutrient concentrations, abnormal concentrations of organic acids provide functional markers for the metabolic effects of micronutrient inadequacies, toxin exposure, neuroendocrine activity, and intestinal bacterial overgrowth. So as we've been going through the program we're developing here in Miami for my practice, what we've learned are that we are using the neuroendocrine bucket as one category, which is adrenal and brain. The G is another one, and then toxins or detox is another one. So organic acids help us figure out which program the patient's going to go into. As such, organic acid testing can indicate the functional need for essential or conditionally essential nutrients, diet modification, antioxidant protection, detox, and other therapies. Excuse me, that's a big, busy slide. So what does that mean? It's going to boil down to this guy right here, which is what we would call cellular metabolism. So our food gets broken down and fatty acids. So let's go backwards a little bit. It's going to be carbohydrates, fatty acids, and protein. And those breakdown products are going to be fatty acids and pyruvate entering the mitochondria. So this is as we get into this is the outer and inner mitochondrial membrane. And I'm just trying to show how fatty acids and pyruvate, so fats and carbs, get broken down, and acetyl-CoA enters the citric acid cycle. The NADHs produced by the citric acid cycle are the electron carriers that go to the electron transport chain. And this is how we produce ATP by the proton pump that gets generated. This is oxidative fast. This is oxygen dependent. So oxidative phosphorylation is what we call this. Glycolysis is in the cytoplasm. All right, that's just a little background. We're going to focus right in here, citric acid cycle. And we're going to talk about pyruvate dehydrogenase right here. So where am I going with all this? Krebs cycle is also called the citric acid cycle, CAC. So conversions of the citric acid cycle intermediates are under control of enzymes, many of which require vitamin-derived cofactors and essential elements for their function. This fundamental pathway of energy flow is critical for all organs. Okay, this is referring to the citric acid cycle. Abnormal spilling of citric acid cycle intermediates in the urine can indicate mitochondrial inefficiencies of energy production. This is what we're calling organic acids. We measure them in the urine. Detection of such abnormalities in the urine, i.e., organic acids, explain the biochemical basis of fatigue and weakness and guide ways to improve energy production by supplying specific B complex vitamins. Since the compounds that make up the pathway are related in a cyclic manner, a block in any step can cause accumulation of multiple compounds that precede that step. Now, here's what we're talking about, and we've spoken about it in other talks. So, the precursor or substrate, usually an amino acid, needs to get converted to a product. So, we're going to focus on the citric acid cycle. So, a cofactor or vitamin defect will not allow the normal product to be produced. So, a defect here will cause this biomarker, whatever it is, to build up and it'll get excreted in the urine. So an example of that, and I got to keep moving these things around in my screen so I can show it to you. Here, methylmalonate is normal. Let me see, this is okay. So now vitamin deficiency. So over here, there's enzyme here, vitamin here. These are what converts to the normal product. So if you got a cofactor vitamin like here, sorry, I got all these boxes I need to move around. A dietary deficiency of a cofactor like a vitamin in the presence of a normal enzyme won't allow the conversion. So the biomarker or substrate builds up and is excreted in the urine. So you treat by increasing the vitamin cofactor or vitamin intake. And we've seen this several times where we see a buildup of, in this example, methylmalonate, which is an organic acid we see in the testing. We see this go up. It indicates that we've got a B12 deficiency. This is one example. This is just a concept. So we're not necessarily measuring B12 directly. We're measuring methylmalonate. And if this is going up, there's a vitamin 12 that's not converting methylmalonate to whatever the byproduct is. Okay, let me see if that's going to be clear here. In this case, we've got an enzyme defect and it's from a SNP. So a genetic defect that does not allow normal production of an enzyme. And this can also present as methylmalonate elevation in the urine, which is a B12 problem. So in this case, you got a genetic defect and you're still going to treat with vitamin B12 or whatever cofactors are required here. And I'll just show you another example. Usually the difference is if it's a SNP, nucleotide polymorphism, single nucleotide polymorphism, SNP, genetic defect, usually requires a lot of whatever the substrates are to convert it. All right, so what the hell did all that just mean? Here we are with our citric acid cycle. Now we're seeing all the conversions that need to take place. And we're seeing the vitamins and cofactors. So pyruvate to acetyl-CoA. Pyruvate requires B1, B2, B3, B5. If any of these are not present in enough, it can be any of them, pyruvate will start to build up because it's not getting the proper conversion to acetyl-CoA. So the treatment's going to be here. Same thing if you look over here. Fat conversion to acetyl-CoA requires carnitine. Carnitine's the shuttle that takes this from the cytosol into the mitochondria. So if carnitine is not adequately supplied, we'll see this with a buildup of organic acids in the urine. Which ones? Adipate, subrate, ethyl malonate. If we were to look over here, not getting conversion of malate to oxaloacetate, it can be from a B3. B3 problem is going to be buildup of malate, and that's indicating it's not getting converted to oxaloacetate. So that's all this stuff was trying to say. In this case, cofactors or vitamins are inadequate, so the precursors are elevated in the urine. These are the organic acids. Is that starting to make sense a little bit? All right, and we've gone through labs and stuff, and but this is the basis of that. We're really why we're measuring the organic acids in the urine and treating based on that. So let's see. All right, let's go back. We'll hit this one in a second. Let's go to this one. Vitamins and minerals. Vitamins are inorganic and minerals are organic. This isn't really described. So vitamin D, we're all familiar with. Vitamin C, these are the main ones. So I just wanted to show this. The B vitamins, you'll hear them. You'll hear it called thiamine or B1, riboflavin, B2, niacin, it's usually called niacin, and that's B3. Pantothenic acid, B5, pyridoxine, B6, biotin, B7. Folate, you hear a lot, that's B9. Cobalamin, you hear a lot, that's B12. So these guys are super important, as we just saw. Vitamins, B vitamin, B3, B vitamins, they're everywhere. B vitamins required everywhere to get this to work. And that's why you've heard your whole life B complex, doctors prescribing B complex. All right, so what did I want to show you here? I wanted to get to this. This is from Richard Lord's book. So I'm going to talk about these organic acids and these branch chain amino acid metabolism. So we're trying to, here we go. So this is just to try and get this a little more baked in. Valine, isoleucine, branch chain amino acids, their conversions, their metabolites are alpha keto acids, these three. Valine, alpha ketoisovalerate, the caproate is leucine, isoleucine. Here's your mostly B vitamins that require branch chain ketoacid dehydrogenase to work. So these deficiencies will cause buildup of these keto acids in the urine. This is what we're measuring on the organic acid labs. So if you see alpha ketoisovalerate elevation in the urine, that tells us that valine is not getting converted properly. Same thing, alpha ketoisocaproate in the urine tells us there's a leucine metabolism problem. Where is the problem? Is it a SNP? It's going to be something in here is required for these dehydrogenase to work. I don't want to get down here yet. So this is just conceptual, all right? Here's your branch chain amino acids. They need to be converted for whatever reason. These are their keto acids, organic acids that we're measuring in the urine. So it's not a direct measurement of a valine problem. This would have to be in the plasma with an amino acid test. We're measuring in the urine with an organic acid test. You could measure in the plasma with an amino acid test, but this is the basis of the organic acid test in the urine. Let's see if I can get you. So this is what we just mentioned, isoketovalerate, high alpha keto isovalerate, a functional marker of thiamine deficiency in B vitamins, and producing the metabolism of valine. Let's go back. Valine, isoketo isovalerate, say it again. Valine metabolism, either undereating, vitamin B deficiencies. Sorry, this might be easier just shrinking this thing. All right, these deficiencies. These are 1, 2, 3 vitamins here. Lipoate, pantothenate. I think we said it was B6. That's what this is saying right here. High alpha ketoisovalerate. This guy is a problem with valine metabolism. This guy can be caused by many things, including poor diet, because you're not getting the vitamins and minerals through your diet. Vitamin B deficiencies. These guys deficient. This builds up because we can't convert valine. Symptoms, vague. Fatigue, sleep disturbance, poor memory, irritation. These symptoms are present in a lot of things. So if you see high alpha ketoisovalerate, what do? Improve diet and absorption. Maybe there's a infection in the GI tract. So you need maybe a GI map test to see where the GI problem is. Assess dietary intake. Supplement with B vitamins, especially these. Why these? Because these are the ones required to get this enzyme to function. All right, this is just trying to, the overall concept. We don't have, this is going to say this exact same thing for this one. Alpha keto isocaproic acid, which is leucine. This guy, leucine not getting converted. This is going to build up to caproic acid, leucine problem. Same type of not eating well, vitamin B deficiency, same symptoms. Now, pyruvate dehydrogenase. This is a big enzyme, 3 components, E1, E2, E3, that make this enzyme work, converting pyruvate to acetyl-CoA. I'm showing you this one because this is a big dog right here. This is carbohydrate metabolism. If you got pyruvate dehydrogenase not working well, you can't get pyruvate to convert to acetyl-CoA in the mitochondria, and your entire Krebs cycle and everything downstream suffers. Big enzyme, so thiamine problem, B1 deficiency, not going to get a good pyruvate dehydrogenase function. Lipoic acid, that's why you'll see all the lipoic acid supplementation with blood sugar dysregulation. Well, what does blood sugar dysregulation mean? Carbs aren't getting through the cycle properly, so oxidative phosphorylation and ATP production is going to suffer, i.e. low energy fatigue. This is a big gateway into the cellular energy production pathway. So lipoic acid, here we go, lipoate up here. You need lipoic acid in these B vitamins to make pyruvate dehydrogenase convert to acetyl-CoA. Where did these come from? Why is this on this diagram? Right here. B1, lipoic acid, B2, B3, big enzyme, all reflected right here. So pyruvate is elevated on your organic acid test or lactate. That's going to tell you you've got a blood sugar problem, which is carbohydrate metabolism. This is a big step right here. There is a SNP for the pyruvate dehydrogenase complex that requires mega B vitamins to treat. All right. So E1, E2, E3, these are the 3 components of this big enzyme, pyruvate dehydrogenase. These are the cofactors and vitamins that make it function, B1, B2, B3, and lipoic acid. Any of these are defective or deficient, or any problems with this enzyme components, cofactors. Let's go back here. Any problems with the enzyme component or cofactor? We're going to get a buildup of the organic acid. Well, we're not going to get this proper conversion, so you're going to get the organic acid buildup in the urine. In this example, pyruvate needs to get to acetyl-CoA. We got a problem with the pyruvate dehydrogenase enzyme. We're going to get the urine elevation. All right, so is that making sense? Any questions? It really just encompasses basic concepts of why we're supplementing with vitamins and lipoic acid. And then again, this is the detailed version of why, but when we test any of these problems, we'll put them in the mitochondria bucket, in the mitochondria program. And most mitochondria program requires free-form amino acids, B vitamins, magnesium coenzyme CoQ10, and that's basically all the substrates that we need to get this to function. We don't really need to worry about all that stuff I just said, memorizing any of this. We just need to look on the organic acids test, see what's elevated. And let me see, because we went this last time. Let me see if I can find this for you real quick. Should have had this one prepared. I think we went through this last time. Let me see if this comes up. Here, fatty acid metabolism, carbohydrate metabolism, energy metabolism. This is the mitochondria bucket. So any abnormalities here, doesn't even, here's our alpha ketogluteric acid we just talked about, succinate malate and fatty acids. So it doesn't really matter exactly which one. We're just going to say mitochondria program, and the supplements are, and here's your symptoms. And that applies to all these, whether it's a brain inflammatory marker like kynurenate, catecholamine marker, dopamine or norepi metabolism with HVA and BMA. We're just creating broad programs. So this is the mitochondria program or blood sugar problem program or fatty acid program or Krebs cycle. So it's all this stuff we just talked about and why. And it's just basically that we're having trouble with conversions. And the big one is this, just shows you the big enzyme, all the cofactors and vitamins required for these enzymes to function, and what would happen if it's not functioning. Pyruvate doesn't get converted to acetyl-CoA. This entire mechanism, cellular respiration, we call it, gets jammed up. And you don't have to go in finding every little piece. You just treat them with the supplements, the mitochondria program, which we can go into more detail another time. I just really wanted to highlight this, why the organic acids work, why we test them. All right, questions, comments? It's really one concept. Look how long it took me to explain it. And I don't even know if I explained it well. All that to say why we give supplements and why B vitamins are such almost in every program. And then there's other things we'll get into later. What puts pressure on here? Why would a GI tract infection cause oxidative stress and put pressure on the system? Why can emotional stress put pressure on the system? Why can anything disturb the cellular function? And that's really what, at least to me, functional medicine is. Another big part of the mitochondria program is food and exercise. Most mitochondria are in the skeletal muscle. And that's why you need muscle to have mitochondria, to have energy. So you can give all the supplements you want. If you're not eating the right food and doing the right exercise, you're not going to get effective mitochondria. You're going to get bad oxidative stress. There's good oxidative stress also. We'll talk another day. But all I wanted to hit, because we've talked about why we've been supplementing people, and we haven't really explained why the organic acids metabolites are used. So that's why. Questions? Call it a night. Where are we at? All right, I think that's it. So that's tonight's lesson for IVC community. We'll get it posted. All right. Good night.
Thank you. Have a good night.
Thank you so much. Have a good night, guys.